Hi everybody, I'm Coach Doug O, and today we are going to be doing a lunch and learn on how to manage your blood sugars. We're also going to give you some tips, okay, if you want to lower your blood sugars before your A1C gets a little too high and you're labeled type 2 diabetic or pre-diabetic. So, first of all, let's go over managing blood sugar. Why is it important? It is important to keep your blood sugar levels in your target ranges as much as possible to help prevent or delay long-term serious health problems such as heart disease, vision loss, and potentially kidney disease. Staying in your target range can help improve your energy and your mood. We are now going to figure out how, to check your blood sugars. Well, if you just recently had your health risk assessment, they do test your blood sugars more often than not with the A1C. The A1C is a number that you get, and typically you want to be below 5.7. If you are between 5.7 and up to 6.2, you might be labeled pre-diabetic. If you're over that, you might want to consult your doctor, or one of our health consultants here at the Three Ways Clinic, Oshkosh. Okay, well, if you don't have your A1C or if you do not know where to find it on your sheet, feel free to use a glucometer, Basically, what that is going to do is monitor your blood sugars with just a little finger poke. That blood sugar meter measures the amount of sugar in a small sample of your blood, usually from the fingertips. If you do not have one of these monitors, which you can purchase at Amazon or any other store, you can also make an appointment to have your blood sugar taken here at the Three Ways Clinic Oshkosh if you are on the insurance plan. So it is important to know your numbers, When you know your numbers, you can definitely see, where you're at, in regards to whether you're normal, pre-diabetic, or potentially diabetic already. A lot of times people don't even know they're diabetic, until it's a little bit too late in the game. So, know your numbers, folks. All right. When should you check your blood sugars? Now, whether you have a meter or if you're going to make an appointment for one, you should often check your blood sugars, Number one, on the type of diabetes that you have, or if you are labeled pre-diabetic. Typical times to check your blood sugars include, first, when you wake up in the morning, before you eat or drink anything. It's also important to check it before a meal, 2 hours after a meal, and at bedtime. If you have type 1 diabetes, have type 2 diabetes, and take insulin, or often have low blood sugar, your doctor may want you to check your blood sugar more often, such as before and after you are being physically active. What are blood sugar targets? Well, before a meal, you want it between 80 to 130 mgs/dls. 2 hours after the start of a meal should be less than 180 ml/dl. Your blood sugar targets may be different depending on your age, any additional health problems that you have, and many other factors. So be sure to check with your doctor. In regards to the glucose meters, typically, you want to be, about 100 or less, If, let's just say, you are not pre-diabetic or diabetic, you want to be under 100, What causes low blood sugar? Well, low blood sugar, also called hypoglycemia, has many causes, including the missing of a meal, taking too much insulin, taking other diabetic medicines, exercising more than normal, and drinking alcohol. Blood sugar below 70 mgs is considered low. Once again, typically about 90 to 95 is not a bad number. So this is what causes low blood sugars. If, you notice any of these symptoms, you might have low blood sugar. Shaking, sweating, feeling nervousness or anxiety, irritability or confusion, dizziness or hunger. Know what your individual symptoms are, because everybody is different, so you can catch your low blood sugar early so you can treat it. If you think you may have low blood sugar, okay, please check with your primary care provider, one of our providers here at the clinic, so that you can be treated as soon as possible. If you feel that you are having low blood sugars, okay, how can you treat it? Well, if it's below 70 mg's, DLs, what I would say immediately do, drink 4 ounces of some fruit juice, drink 4 ounces of a regular soda, not diet, maybe have some hard candy, okay? Or if you need to, take a glucose tablet. After you take one of these items, wait for about 15 minutes, then check your blood sugar again, okay? Or if you are not feeling any better, you might want to check with your provider or see medical treatment as soon as possible. So that's if your blood sugars are too low. What if your blood sugars are too high? If your blood sugars are too high, many things can cause high blood sugar. Hyperglycemia. It includes being sick, being stressed, eating more than planned, not giving yourself enough insulin. Over time, high blood sugar can lead to long-term serious health problems. Symptoms of high blood sugar include feeling very tired, feeling very thirsty, having blurred vision, or needing to go to the bathroom more often. If you get sick, your blood sugar can be hard to manage. You may not be able to eat or drink as much as usual, which can affect your blood sugar levels. If you're ill and your blood sugar is over 240 mg's DLs or above, okay, you might want to make sure that you definitely check with your doctor as soon as possible if you are not feeling well. Okay? Ladies and gentlemen, whether you're type 1 diabetic, whether you're type 2 diabetic, pre-diabetic, you really want to make sure that you know your numbers. You want to make sure you have an action plan. Okay? So, how can you treat high blood sugars? Okay? Well, what you want to do is you want to consult your doctor. All right? Your doctor might suggest the following: be more active. Regular exercise can help keep your blood sugar levels on track. Okay? Take medicine as instructed if they're given to you. If your blood sugar is often too high, your doctor may change how much medicine you take and how often you take it. Follow your diabetic meal plan. Ask your doctor or your dietitian if they have any suggestions for you. I can definitely suggest some options for you, okay? But you want to make sure you are sticking to a meal plan. Once again, you want to also check your blood sugars regularly, okay? Ladies and gentlemen, whether it's low blood sugar or high blood sugar, always consult with your physician regularly and make sure you have an action plan. All right, how do carbs affect blood sugars? Carbohydrates in foods make your blood sugars level go higher after you eat them, and then you eat proteins and fats, typically with them. The proteins are actually going to help regulate your blood sugars, okay? Can you still eat carbs if you're diabetic? Yes, you can. However, what you want to do, though, is you want to have a carb with a protein to help regulate your blood sugars. It's also important to count your carbs. When you count carbs in foods and drinks, is an important tool for managing your blood sugar levels. Be sure to talk to one of your healthcare team members, okay, about the best carb goals for you. Some might suggest keto. I always suggest doing moderation with our carbs. To me, that is more realistic and more manageable for everybody. All right, earlier I did mention an A1C test, and a lot of times those are done with your health risk assessment. Sometimes they're not. Feel free, okay, through your provider to get an A1C test done if it's been a while or if you have not seen it on your test results. Okay? The A1C test is a simple blood test that measures your average blood sugar levels over the past 2 to 3 months. The test done at your lab or our office here at the clinic, okay, is basically to help regulate your numbers so we can kind of see where you're at. A1C testing is part of the ABCs of diabetes. The important steps you can take to prevent or delay health complications down the road. A stands for get a regular A1C test. B, try to keep your blood pressure below 140 over 90. C, manage your cholesterol levels. And S, stop smoking or don't start. Those are your ABCs of your A1C. The A1C goal for most adults with diabetes is between 7 and 8%. But your goal may be different depending on your age, other health conditions, medicines you're taking, and other factors. Once again, work with your doctor to establish your personal A1C goal for you. What else can I do to help manage my blood sugar levels? Ladies and gentlemen, write these tips down. Eating a healthy diet with plenty of fruits and veggies. Yes, there are carbs in fruits. Moderation, folks. Also, maintaining a healthy body weight. Getting a regular physical activity in each and every day can all help in regards to managing your blood sugar levels. Other things you can do, keep track of your blood sugar levels, okay, to see when they go up and down. So be knowledgeable of your times. Eat at regular times and don't skip meals. Choose foods lower in calories, saturated fats, trans fats, sugars, and salts. Track your food, drink, and physical activity. Drink water instead of juice or soda. Limit alcoholic beverages. For a sweet treat, try fruit. Finally, control your food portions. Ladies and gentlemen, this is the best way of going about it. When you do everything in portion control, moderation, that helps you. If you are being told no every time, you're not going to stick with it. Find something that you can stick with, and that's going to help you manage your blood sugar levels. Ladies and gentlemen, this right here is just basically a general guideline and some tips to help manage your blood sugars. Don't forget, you have to know what your blood sugars numbers are. Number 2, once you know what your numbers are, seek medical providers' help. And then also 2, remember to monitor yourself by exercise and nutrition so you can actually help get these numbers in check. Ladies and gentlemen, I want to thank you for your time. Hopefully, I made you more aware, okay, of potential risks with diabetes. If you do have any questions, I want you to reach out to the health coach, Doug Laughlin, that's me, and I'm more than welcome to help you out. Ladies and gentlemen, thank you so much for your time. Thank you so much for your effort, as always, and I want you to have a great day. Thank you, everybody.